Dr. Roberta Hawk joins us from Yellowstone Dermatology, and May is Skin Cancer Awareness Month. So how I guess big of a deal is skin cancer awareness, and why is it so important?
So basal cell skin cancer is the #1 cancer, period, in the United States. And it's very treatable. So if we can find and identify skin cancers, we can save people a lot of hassle down the road. But another reason it's important is melanoma skin cancer, which is one of the deadlier cancers. If it's caught early, you can have a 99% 5-year survival, and if it's caught late, it may be as low as 20%. So we can do a lot if we catch these things early.
And what is it that you think keeps people from actually going in and seeing a doctor? I mean, they obviously see these marks on their bodies. What keeps them from taking the next step?
Sometimes I think it's cost. Sometimes I think they're afraid of what they might hear. And sometimes I think they've just had it for so long and it hasn't really hurt them, so they think it must be just fine.
And you mentioned it can be deadly.
Oh yes.
Can be
oh
deadly.
yes. 1 American dies every hour in the United States from melanoma skin cancer. That's pretty scary. That's 10,000 people a year. And a lot of that is preventable because the #1 cause of melanoma is sun exposure. Sunlight exposure either in tanning beds or in the sun. And we can do a lot to protect ourselves against that. So not only can we get screened to make sure we don't have something changing or bad, we can also protect ourselves from the main cause of cancer, skin cancer.
And you were mentioning before we started this interview, a lot of people think putting on sunscreen is enough, but what has to happen beyond that?
So I started cussing this year because I've been telling my patients for many years that sunscreen is inadequate, and nobody's really heard me. So my 4-letter word, am I allowed to cuss on air? I don't know. My 4-letter word for sunscreen is crap.
Oh, okay.
Because we put too much credence in this thin little layer of lotion to protect us from the sun. So the FDA hasn't approved a new sunscreen ingredient in 18 years. The sunscreens only protect mostly against UVB. They ignore all the other wavelengths of light. And we only get 1/4 the number on the label. So if you wear an SPF 15 and think, oh, I'm doing the right thing, you really only have a 3.75 protection on.
Wow.
So I trust sunscreen from the neck up and clothing from the neck down.
Yep, get those arms covered. All right, and Yellowstone Dermatology actually wants to help people out. You mentioned cost might be a concern, but you have a free screening coming up.
We
Tell
do.
us about that.
We do. On May 12th, because this is Skin Cancer Awareness Month, we are having a free skin cancer screen at our clinic. And all you have to do is call or even show up that day if you would rather not call. If you're one of those last-minute people and you've got to procrastinate, that's fine. And we'll be happy to look at that molar spot and either tell you, yes, it needs to be treated, or, hey, you can rest easy now. That's nothing to worry about.
All right. Well, Doctor, thank you so much for joining us this morning, and thank you for looking out for the community. You gave out a lot of helpful information this morning.
You're welcome.
Thank you so much. We'll be